Part 3 of diabetes, beginning with delayed wound healing. So we looked at a little bit of wound healing in the immune system. This is just another way of looking at the phases of wound healing. Phase 1 of wound healing is inflammation. So you're going to have your injury. You're going to have blood clotting to stop bleeding. And then you're going to have inflammation set in. And inflammation is present to, again, recruit those leukocytes into the area if there is to fight infection. So with inflammation, right, we have a lot of cytokines being secreted. We have platelets being activated, recruiting neutrophils, recruiting monocytes, and they're all coming via chemotaxis. Then we have the proliferation phase. So this is inflammation. The proliferation phase where we're going to increase the amount of white blood cells in the area by them reproducing. We're also going to have fibroblasts building the new connective tissue scaffolding. We're going to have capillaries growing into that new tissue. We're going to have regeneration of endothelial cells. So we're just kind of repairing the tissue, getting ready for organizing. And then the last step is remodeling, which is to then have the same structure, right? The collagen fibers running in a certain direction. So we're going to organize the tissue. This is going to form some scar tissue, and this can last from 3 weeks to a year. So we have these 3 basic phases. Now, how does diabetes affect wound healing? Is that, so this is the sort of normal wound healing. You have your immune cells coming in. Your fibroblasts are cells that build connective tissue. So you have inflammation, proliferation, and remodeling. When you have diabetes, because of glycosylation, it's going to decrease your phagocytes. So it's going to decrease your neutrophils. It's going to decrease the activity of your macrophages. So those are your phagocytes. It's going to slow down your inflammation stage. Because you're glycosylating hemoglobin, you're going to lose erythrocyte flexibility. You're not going to get enough oxygen to the area, and that's going to really strain proliferation because this is a very active phase in wound healing. It's going to use a lot of oxygen, and we want the red blood cells to deliver that oxygen, but if they're not flexible, they're not going to make it there, and so it's going to really delay proliferation. And then it's going to decrease the secretion of your cytokines and growth factors. It's going to decrease the remodeling and proliferation. So we can see that at all these different levels, we can actually get sort of altered or slow wound healing. And one of the sort of hallmark signs of diabetes is getting these foot ulcers. So foot ulcers are really common, and because they are associated, so there's some form of neuropathy present, someone might not notice they have this foot ulcer. Treatments and management of diabetes. At the moment, there's no cure for diabetes. There's medications and there's management. So as you may expect, the primary goal of treatment is to maintain normal blood glucose levels. To do that, they have different approaches, right? So insulin is a very common approach, especially in type 1 diabetes, right? Because type 1 diabetes is insulin dependent. So this is a must in type 1 diabetes, occasionally used in type 2 diabetes, right? Only with some type 2 or gestational diabetes. So insulin can come in a couple ways. You can inject insulin subcutaneously. You can have a pump installed, so it's you don't have to deal with needles if you don't like needles. And there's other ways that the textbook was talking about. They're coming out with suppositories or oral insulin. The reason why we don't have a pill is because insulin is a protein, and proteins, right? If you eat a protein, it's going to get digested in the stomach, right? It's going to get destroyed. And so we want to circumvent the stomach. So that's why insulin is injected. So that's one. Oops. The second, right, is to always know where your blood sugar is. So you want to always check your blood glucose levels with the glucose meter, and always know when and what to eat. So you want a special diet. So that's number 3. Both types of diabetes have to really closely monitor their diet. Healthy diet and regularly exercising helps with both types. But since type 2 diabetes is more of a lifestyle linked disease, diet and exercise is critical in managing type 2 diabetes. Now, type 2 diabetes also has oral medications. So the oral medications that are around are looking at trying to decrease blood glucose levels, right? We saw all the problems that are involved with high glucose levels are going to decrease the glucose levels. So with type 2 diabetes, right, they can take a daily cocktail of pills and liquids, sometimes insulin, but these guys will try other avenues to try and stop high blood glucose. If you are obese, which is linked with type 2 diabetes, diet, exercise, and also your textbook goes on to sort of describe bariatric surgery, which is to staple the stomach or to limit the size of the stomach. Okay, so that's basically it. I'm not going to go into too much detail with the medications. There's a lot of research right now on approaches to diabetes. And a couple, if I want to turn your attention to letter B in the current research, there's aldose reductase inhibitors and sorbitol dehydrogenase inhibitors, and those are going to target the polyol pathway. Let's go ahead and look at the review questions we have. So this is just the pancreas, a little cartoon here. All right, which of the following is not one of the factors that contributes to the impaired wound healing in persons with diabetes? The answer is D, right? We're not going to increase proliferation, we're going to decrease the proliferation of fibroblasts. Which pancreatic cells are destroyed in type 1 diabetes? This should be easy. It is letter B, beta cells. Which of the following is not part of the early symptoms of diabetes or the polys? And the answer is A. Which of the following complications of diabetes is the most common? And this one's going to be answer C, neuropathy. Which of the following symptoms is not associated with hypoglycemia? Okay, so hypoglycemia is low blood sugar, so increased urination is going to be your answer, letter B. That's going to be associated with hyperglycemia. What is the primary mechanism for blood glucose regulation in patients with type 1 diabetes? And this one's going to be letter C, insulin injections. And that's our